Tom Hanks developed type 2 diabetes. And if you only hear that sentence as celebrity news, you may miss the much bigger warning. Because this is not really a story about fame. It is a story about a condition that can creep into someone's life slowly, quietly, and almost politely, until one day a blood test reveals that something has been going wrong for years. The Oscar-winning actor announced he had type 2 diabetes when late-night host David Letterman commented on his newly slim figure. Hanks then explained that doctors had been watching high blood sugar numbers going back many years, reportedly since he was in his 30s, before eventually telling him that he had graduated to type 2 diabetes. The reason his story matters is because it reflects something I see again and again in hospital medicine. Serious conditions often begin quietly, long before people realize anything is wrong. People do not usually wake up one morning with type 2 diabetes out of nowhere. For many people, it builds quietly in the background. A little tiredness, a little thirst, a bit more passing urine, a bit of weight change, a blood test that is borderline, a doctor saying, "Your sugars are a bit high, we need to keep an eye on this." And then life gets busy. You feel fine enough, you carry on, until suddenly the warning signs are no longer subtle. So today, I want to use Tom Hanks' story as a way to raise awareness. Because type 2 diabetes is incredibly common, it affects millions of people, and many people have it or are on the road towards it without realizing. In this video, I'll explain what type 2 diabetes actually is in simple terms. I'll talk through the red flags people often ignore. I'll explain why diabetes is so dangerous if left untreated. And most importantly, I'll explain what you can do to prevent it, detect it early, or manage it properly if you already have it. Because the earlier you act, the more power you have. Let's start with the basics. What is type 2 diabetes? Your body needs sugar or glucose for energy. Every time you eat food, especially carbohydrates, your body breaks some of that food down into glucose. That glucose moves into your bloodstream. From there, it needs to enter your cells so your muscles, brain, and organs can use it as fuel. But glucose cannot simply walk into the cells by itself. It needs help. That help comes from a hormone called insulin. You can think of insulin like a key. The sugar is outside the door. The cell is inside the house. Insulin unlocks the door, so sugar can move from the blood into the cells. In type 2 diabetes, the problem usually begins with insulin resistance. That means your body is still making insulin, but the cells are not responding to it properly. The key is there, but the lock has become stiff. So the pancreas, which makes insulin, tries to work harder. It produces more insulin to force the sugar into the cells. For a while, your body may compensate. Your blood sugar may be slightly high, but not high enough for you to feel seriously unwell. This is often the stage people call prediabetes. But over time, the pancreas may struggle to keep up. The blood sugar rises further, and eventually, the person is diagnosed with type 2 diabetes. This is why type 2 diabetes can be so deceptive. It does not always arrive with dramatic symptoms. It may not cause pain. It may not stop you walking. It may not make you collapse. Instead, it can quietly damage the body from the inside. The blood vessels, the nerves, the eyes, the kidneys, the heart, the brain. And that is why awareness matters, because by the time someone has a heart attack, a stroke, kidney failure, vision loss, or a serious foot infection, the diabetes may already have been causing damage for years. The first red flag people often ignore is tiredness. Now, tiredness is tricky because almost everyone feels tired at some point. We work hard, we sleep badly, we worry, we get older, we look after families. So when someone with early diabetes feels exhausted, they often explain it away. They say, "I'm just busy, I'm stressed, I'm not sleeping enough, I'm getting older." But diabetes-related tiredness can feel different. It can be a deep, persistent lack of energy. You may have slept, but still wake up drained. You may eat, but still feel weak. You may struggle through the day and wonder why your body feels slower than it used to. Why does this happen? Because sugar may be building up in the blood, but not getting into the cells efficiently. So your bloodstream has fuel, but your body cannot use it properly. It is a bit like having a full petrol tank, but a blocked fuel line. The fuel is there, but the engine is struggling. And because tiredness is so easy to dismiss, it is one of the earliest warning signs people miss. Before we move on to the second red flag, if you're finding this video helpful, please consider subscribing to the channel. It genuinely helps this information reach more people who may need to hear it. And it allows me to keep making clear, practical health videos like this. The second red flag is increased thirst. This is one of the classic symptoms of diabetes. But again, people often ignore it. They say, maybe I'm just not drinking enough. Maybe it's the weather. Maybe I had too much salt. Maybe I'm just dehydrated. But when blood sugar is too high, Your kidneys try to remove the extra glucose through the urine. To do this, the body pulls water with it. That means you lose more fluid, and when you lose more fluid, you feel thirsty. So the cycle begins. High sugar leads to more urination. More urination leads to dehydration. Dehydration leads to thirst. Thirst leads to more drinking, and then more urination. If you suddenly find yourself drinking far more than usual, especially if this is happening with other symptoms, do not ignore it. The third red flag is passing urine more often. This is another warning sign that many people explain away. They say, I'm drinking more water, so of course I'm urinating more. Or, I'm getting older. Or, I always wake up at night anyway. But if you are suddenly going to the toilet more often, especially if you are waking multiple times at night, it deserves attention. The medical term is polyuria, which simply means passing a lot of urine. In diabetes, this happens because the kidneys are trying to flush out excess sugar. This symptom can be especially noticeable at night. Someone may say, I used to sleep through the night. Now I'm up 2 or 3 times. That change matters. Of course, there are other causes of frequent urination. In men, prostate problems can do it. Urinary tract infections can do it. Some medications can do it. Drinking large amounts of caffeine or alcohol can do it. But diabetes is one of the important causes that must not be missed. The fourth red flag is unexplained weight loss. This one surprises many people, because when people think about type 2 diabetes, they often think only about weight gain. But unexplained weight loss can be a warning sign. If the body cannot use glucose properly, it may start breaking down fat and muscle for energy. So a person may lose weight without trying. At first, they may even feel pleased. They may think, I've slimmed down, that's good. But the question is always this: was the weight loss intentional? If you changed your diet, increased exercise, and lost weight gradually, that is different. But if you are losing weight without trying, especially with thirst, frequent urination, tiredness, or blurred vision, you should seek medical advice. Unexplained weight loss should never be ignored. The fifth red flag is blurred vision. High blood sugar can affect the fluid balance in the eyes. This can change the shape of the lens and cause blurred vision. Some people notice that their vision comes and goes. One day it is fine, another day it is blurry. They may think they simply need new glasses. And yes, sometimes they do. But if vision changes happen alongside thirst, tiredness, or frequent urination, diabetes needs to be considered. Over time, diabetes can also damage the tiny blood vessels at the back of the eye. This is called diabetic retinopathy, and if not detected and treated, it can threaten sight. That is why people with diabetes need regular eye screening, not because every person with diabetes will go blind, but because eye damage can begin silently. Screening gives doctors a chance to detect problems early. The sixth red flag is slow healing. A small cut takes longer to close. A scratch becomes infected. A blister on the foot does not settle. A minor wound becomes a bigger issue. High blood sugar affects the immune system. It affects circulation. It affects the body's ability to repair tissue. That means infections can become more frequent, and wounds can take longer to heal. This is especially important when it comes to feet. Diabetes can damage nerves, so a person may not feel pain properly. They may step on something, develop a blister, or have pressure from a shoe and not realize. At the same time, diabetes can affect blood supply and healing. That combination is dangerous. Loss of sensation, poor healing, infection, reduced circulation. That is how a small foot problem can become a serious medical emergency. So if someone has diabetes, foot care is not optional. It is essential. The seventh red flag is tingling, burning, or numbness. This often starts in the feet. Some people describe pins and needles. Some describe burning pain. Some say their feet feel like they are wrapped in cotton wool. Others simply notice that they cannot feel the ground as well. This can be diabetic nerve damage, also called neuropathy. It usually develops gradually, and because it is gradual, people adapt to it. They may not realize how much sensation they have lost. But numbness is dangerous because pain is protective. Pain tells you when something is wrong. If you lose that warning system, injuries can go unnoticed. The eighth red flag is repeated infections. This can include skin infections, urine infections, gum infections, or thrush. High sugar levels can make it easier for certain infections to take hold. If someone keeps getting infections again and again, especially with other symptoms, diabetes should be considered. Again, this does not mean every infection is diabetes, but repeated infections are a clue. The ninth red flag is increased hunger. Some people with diabetes feel hungry more often, even after eating. This happens because glucose is not being used properly by the cells, so the body can behave as though it is short of fuel. even when there is plenty of sugar in the blood. This can become confusing. You eat, you feel hungry, you feel tired, you gain weight, or sometimes you lose weight, and the underlying problem remains hidden. Now, before we go further, I want to address one of the biggest misunderstandings about type 2 diabetes. People often think diabetes only affects people who are extremely overweight. That is not true. Weight is a major risk factor, yes, but it is not the only one. Age matters, family history matters, ethnicity matters, physical activity matters, blood pressure matters, cholesterol matters, sleep matters, certain medical conditions matter, certain medications can increase risk, a history of gestational diabetes matters, polycystic ovary syndrome can matter, and some people develop type 2 diabetes even if they do not fit the stereotype. This is why shame is so unhelpful. Shame makes people avoid testing. Shame makes people hide symptoms. Shame makes people feel they have failed. But diabetes is a medical condition. It needs honesty, prevention, treatment, and follow-up, not judgment. Now let's talk about prediabetes, because this is where many lives can be changed. Prediabetes means the blood sugar is higher than normal, but not yet in the diabetes range. Many people with prediabetes feel completely well. They may have no symptoms. They may only find out because of a routine blood test. But prediabetes is not harmless. It is a warning light on the dashboard. It tells you that the body is struggling with blood sugar control. And this stage is important because lifestyle changes can make a major difference. Not always, not for everyone, but for many people, this is the moment where action can prevent or delay type 2 diabetes. And that is what makes Tom Hanks' story so relevant. He described years of high blood sugar readings before diagnosis. That is the point many people need to hear. If your doctor tells you your sugar is borderline, do not treat that as meaningless. Do not say, well, it's not diabetes yet, so I'm fine. That is exactly the time to act. Because the earlier you act, the easier the mountain is to climb. So what should people do? First, know your numbers. This is not glamorous advice, but it is powerful. Ask your doctor or nurse whether you need testing for diabetes. The common test is called hemoglobin A1C. This gives an idea of average blood sugar over the previous 2 to 3 months. You may also have fasting glucose or other tests depending on your situation. But diabetes care is not only about sugar. You also need to know your blood pressure, your cholesterol, your weight, your waist measurement, your kidney function, and your overall cardiovascular risk. Why? Because diabetes is not just a sugar problem. It is a blood vessel problem. People with diabetes are at higher risk of heart attack and stroke. So managing diabetes properly means protecting the heart, brain, kidneys, eyes, nerves, and feet. Second, look at your diet honestly, not with panic, not with punishment, but with honesty. One of the most powerful things a person can do is reduce sugary drinks. This includes full sugar fizzy drinks, energy drinks, sweetened juices, and large amounts of sugar in tea or coffee. Liquid sugar enters the bloodstream quickly and does not make people feel full in the same way as solid food. Next, look at refined carbohydrates and ultra-processed foods. White bread, pastries, biscuits, sweets, cakes, large portions of chips, sugary cereals, frequent takeaways. These foods are not evil, but if they make up a large part of the daily diet, they can push blood sugar and weight in the wrong direction. A more diabetes-friendly pattern often includes more vegetables, more fiber, more whole grains, more beans and lentils, more nuts, healthier protein sources, and fewer sugary snacks. For many people, portion size matters just as much as food choice. A plate does not need to be perfect, but it should be balanced. A simple way to think about it is this: half the plate with non-starchy vegetables, a quarter with protein, a quarter with higher fiber carbohydrates, and add healthy fats in modest amounts. That is not a strict rule for everyone, but it is a useful starting point. Third, move your body. Exercise makes the body more sensitive to insulin. That means insulin works better, and you do not have to become an athlete. Walking helps, cycling helps, swimming helps, dancing helps, gardening helps, resistance training helps. Even standing up more and breaking long periods of sitting can help. The key is consistency. If you are inactive, start small. 10 minutes of walking after meals may be a realistic beginning. Then build. The best exercise is not the one that sounds impressive. It is the one you will actually keep doing. Fourth, if weight loss is needed, aim for sustainable change. This is a sensitive topic. Weight can be emotional. Many people have tried diets before. Many have lost weight and regained it. Many feel judged before they even enter the room. But even modest weight loss can improve insulin resistance and blood sugar control. You do not need to transform overnight. Small changes maintained over time can produce meaningful benefits. For some people, structured weight management programs help. For others, medication may be appropriate. For some, bariatric surgery may be considered. This should be personalized. The message is not just lose weight. The message is get proper support. Fifth, sleep matters. Poor sleep affects appetite, hormones, weight, and insulin resistance. Sleep apnea, where breathing repeatedly pauses during sleep, is especially important. If someone snores heavily, wakes unrefreshed, has morning headaches, or feels sleepy during the day, they should discuss this with a doctor. Treating sleep apnea can improve health in many ways. Sixth, stop smoking if you smoke. Smoking damages blood vessels. Diabetes damages blood vessels. Together, they are a dangerous combination. Stopping smoking is one of the best things a person can do for their heart, brain, legs, kidneys, and overall health. Seventh, take medication seriously if prescribed. There is sometimes a belief that needing medication means failure. It does not. Medication can protect you. Metformin, for example, is commonly used in type 2 diabetes. Other medications may help lower blood sugar, support weight loss, protect the heart, or protect the kidneys depending on the person. The right treatment depends on age, kidney function, other medical conditions, cardiovascular risk, weight, and personal circumstances. Do not stop diabetes medication without medical advice. And if side effects occur, speak to your healthcare team. Often there are alternatives. Eighth, attend your regular checks. This is where many complications are prevented. Diabetes care usually involves checking A1C, blood pressure, cholesterol, kidney function, urine protein, feet, and eyes. These checks may feel routine, but routine checks catch silent damage. And silent damage is exactly what we are trying to prevent. Now let's imagine two different futures. In the first future, someone notices they are thirsty, tired, and urinating more often. They ignore it. Years pass. Their blood sugar remains high. Their blood pressure is also high. Their cholesterol is not treated. They miss appointments. They do not check their feet. They do not attend eye screening. Then one day, they develop chest pain, or a stroke, or kidney problems, or a foot ulcer. At that point, everyone takes it seriously, but damage has already been done. In the second future, the same person notices the symptoms early. They book an appointment, they get tested, their A1C is high, they are diagnosed. It is frightening at first, but they get support. They change their diet gradually. They start walking. They lose some weight. Their blood pressure is treated. Their cholesterol is managed. They attend eye screening. Their feet are checked. Their kidney function is monitored. They take medication if needed. And instead of diabetes silently damaging their body, it becomes a condition they understand and manage. That is the difference awareness can make. Not perfection. Awareness, action, follow-up. Now, what symptoms should make you seek medical advice? Feeling very thirsty, passing urine more often, especially at night, feeling unusually tired, unexplained weight loss, blurred vision, slow healing wounds, tingling or numbness in the feet, repeated infections, increased hunger, or simply feeling that something has changed in your body. If these symptoms are severe, or if someone is drowsy, confused, vomiting, breathing unusually, or very dehydrated, that can be urgent and needs immediate medical attention. But most people should not wait until things are severe. Speak to your doctor earlier. Ask if diabetes testing is appropriate. And if you already have diabetes, do not just focus on the sugar number. Ask these questions. What is my A1C? What is my blood pressure? What is my cholesterol? Have my kidneys been checked? Have my eyes been screened? Have my feet been examined? What is my risk of heart attack or stroke? Do I need medication to protect my heart or kidneys? What lifestyle changes would make the biggest difference for me? These are practical questions. They move diabetes from fear into management. And that is important because type 2 diabetes is not a moral judgment. It is not a character flaw. It is not something to hide from. It is a condition that needs attention. Tom Hanks' story caught public attention because he is famous. But the real lesson is not about Hollywood. The real lesson is that high blood sugar can be present for years before the diagnosis lands. So if you take only one message from this video, take this. Do not wait for diabetes to announce itself dramatically. And if your body is giving you clues, listen. If your blood tests are borderline, act. If you have risk factors, get checked. If you already have diabetes, manage it seriously. Because this is not just about sugar. It is about protecting your future. Your eyesight, your kidneys, your feet, your heart, your brain, your independence, and your life. The hopeful part is this: you are not powerless. Type 2 diabetes can often be prevented, delayed, improved, or controlled with the right combination of lifestyle changes, monitoring, medication, and support. For some people, remission may even be possible. But even when remission is not possible, good management still matters enormously. Better control means lower risk. Better monitoring means earlier detection. Better treatment means fewer complications. So please do not ignore the quiet signs. Do not dismiss thirst as nothing. Do not dismiss tiredness as just age. Do not dismiss nighttime urination as normal without checking. Do not dismiss blurred vision. Do not dismiss slow healing wounds. And do not dismiss a borderline blood test. That borderline result may be your opportunity. Tom Hanks' diagnosis became a headline. But for millions of ordinary people, the same condition develops without headlines, without cameras, and without warning bells. That is why we talk about it, because awareness can change the ending. If this video makes one person book a blood test, one person take their symptoms seriously, one person attend their diabetes review, one person check their feet, one person improve their blood pressure, or one person prevent a stroke or heart attack, then it has done its job. Take care of your body, listen to the red flags, and if something is changed, please get checked. Because with diabetes, what you catch early, you can often change. And what you manage properly, you can often live with for many years.